It's important that we isolate the teeth when we are in the area we are working on. This is a cheek retractor placed in the patient's mouth to keep the teeth clean of all the lips. It's okay to put a high-speed suction and ask the patient to bite on it. Okay. The next step would be to scale the teeth, because any little bit of calculus will not allow a proper bond to take place. Using an ultrasonic scaler to clean the buccal surface of the central and the lateral incisor, the teeth on which I am going to show you how to bond the bracket. That's one step over. Next we go to the polish. We use a fluoride-free pumice powder applied on the surface of the teeth. Right? To give a circular motion, make sure that the powder there doesn't go dry. Because if it goes dry, it's going to cause a lot of abrasion on the tooth surface. This is done. Okay, next stage is to wash off this. I could also ask the patient to rinse, but that involves a lot of time. So here I am done with by just putting this. You can see, compare the two teeth from the both sides and you will know how much work we have been able to do. This is an etchant, a good quality etchant, 37% phosphoric acid etching gel. I'm going to apply it on the surface of the teeth. Okay, that's the area I need to use as a area for putting my brackets. That's good enough time. I'm going to wash this off. And I'm going to dry it. Now drying it does not mean desiccating it. You will find that the teeth have become a dull white appearance. This tooth is now ready to receive a bracket. Okay, you should not desiccate it. Now here I have the primer. The primer, which is the form of a liquid. I take the primer, I apply it on the tooth surface where I am going to put the bracket. Okay, I also use the primer on the mesh pad of the bracket that I am going to bond. Right? Okay, that's done. You see I have applied the primer evenly on the two tooth surfaces. This I am going to cure. Right now I am curing the primer which I have applied to the tooth surfaces. Okay. I am also going to cure. This takes about 20 seconds to cure. I am also going to cure the primer that I have attached or I put on the mesh pad or the bracket that I am going to bond for this patient. This is now ready. That was one of them, and this is the second one of them. Actually, when you are doing the full case bonding, you can apply the primer to all of them. If you have a very number of these bonding tweezers, it is recommended to have 8 at a time, so that you can put all 8 one after the other. Now this is the bonding material which I am going to use. It's a paste form. I am going to take out a little bit onto the glass slab. I have a probe here with me. Straight line. slide the bonding material on the mesh of the bracket. Place the bracket on top of the tip. Now use a straight probe to remove the excess flash from around the bracket. Then I would like you to refer to the bracket placement chart that has been provided. The central size of the bracket will be placed at 4 millimeters. Here we are. Check this out. The height of 4 millimeters. Okay. We're done with it. We again try to remove the flash from around the tip. Right. That is the central incisor bracket in position. This is the lateral incisor bracket that I have got in my hand. Place it here. You will notice that the mark is on the distal gingival ring of the bracket. This bracket on the lateral incisor, your chart will tell you, is placed at 3.5 millimeters from the incisor edge. And here we go. And again remove all the excess flash from around the bracket. So the bracket is moved. So I will again go back, reposition it because accuracy is important to my treatment. There we go. Now I will cure these brackets by providing light from all the sides. Remember, light does not pass through metal. So if you try to put it on top of that, you are hardly getting anything. You have to provide the light from around the sides of the bracket. This is almost about 30 to 40 seconds on all sides. This is the incisal side being cured through the light. This is the gingival side being cured through the light. You will notice that the suction machine is on. The saliva does not collect in the mouth. The patient is not at a discomfiture. He is not discomforted at all by what the goings on are. And I don't have to hold the suction tip with my hand. I just ask the patient to bite on the suction tip. So leaves my hands free and leaves my assistant also from doing the job. Now having placed those two brackets, I think I can push it and see how well they have been placed. Here you are. See? Having placed very well. That's the way you continue to the rest of the teeth. Remember, the brackets for the upper are different from the lower. The brackets from the right hand side are different from the left hand side. Be very careful how you place them. In one of the lectures, I will tell you what happens when you place a bracket from the right side on the left side or vice versa.